Well, here in the U.S., we spend roughly 50% more on health care than any other country in the world, an expense not everyone can afford. 47 million Americans are now without health insurance, and such lack of coverage is believed to cost our economy in lost productivity up to $130 billion each year. Today, our focus is on the issue of health care availability, and we begin with a novel Oklahoma program to help subsidize health insurance for low-income employees. Here's our Hannah Wright.
In the past, Patrick Hutchinson has found it hard to supply group insurance for his employees.
The company pays 80% of the employee premium, and the employee had to pay 20% of their premium, but they had to pay 100% of any premiums for dependents or spouses. And even at that, with the company taking most of the burden off of the premium, it was still a struggle for some of our employees to afford insurance.
And many employees of Hutchinson Products simply didn't accept the insurance because they still couldn't afford it. But in recent years, things have been a little easier for Hutchinson and his employees, thanks to a program called Insure Oklahoma. Oklahoma Healthcare Authority CEO Mike Fogarty.
As you know, we're literally in a crisis, both nationally, but in particular in Oklahoma, with people not being able to access health care because they can't access affordable insurance to cover the cost of health care. So it's a devastating situation.
Basically, Insure Oklahoma offers subsidies to the employer offering health care benefits, and it eases the premiums both the employer and the employee have to pay.
If the employer offers a commercial plan, then the employer pays a small percentage, 25% of the premium, the employee pays 15% of the premium, and then the program subsidizes the balance, the 60%. So it really just makes the difference between whether people can afford to access that insurance or they can't.
And unlike most commercial plans, the employee's spouse and dependents can be covered on the same plan at the same percentage breakdown. On average in Oklahoma, an employee and their spouse earning the state's median income of $37,000 would pay 33% off the top toward an insurance policy.
It would take a third of that gross income to purchase a policy that would cover an employee and their spouse, or an employee and spouse and child. Well, obviously that's unattainable. A minimum wage employee, it would cost more than they make to access commercial health insurance.
Take a deep breath.
Fogarty says 1 in every 5 Oklahomans does not have health care, and 80% of those people are working adults.
The objective through Insure Oklahoma is simply to make it affordable for those people to participate.
And employees who are insured because of this program are relieved to know they're protected by a plan that's easy on their pocketbook.
It's just a big relief, you know, knowing that if something's wrong with my daughter or I, that we can go to the doctor, you know, you don't have to, it's something I can afford.
That helps them be able to afford insurance that they really need, health insurance. It helps them get their spouse coverage if they need it, which has been really big for some of our people. And it also helps the company because it relieves some of that premium burden from the company. So we have more money to work with for benefits and other programs that we have. So.
With so much available assistance, some may be wondering where all of this money is actually coming from.
We fund this with state dollars that, as you know, were raised by a vote of the people when they voted to have a tax on tobacco products. So that raises the state money. But for every dollar the state raises, the federal government, through the Medicaid program, the federal Medicaid program, gives us another $2.
Money most involved believe is very well spent.
It's a great program, and it has really benefited our people.
So Hannah, what has been the reception for the Insure Oklahoma program?
Well, Rob, the response to the program since it began in 2005 has been really positive. It's had some time to grow and adapt and is now receiving national recognition. Some even say it should be used as a model for our national healthcare system.
So tell me, who is exactly eligible for Insure Oklahoma?
For employers, it's those with less than 50 employees that provide commercial healthcare packages. Now for individuals, it's someone who makes less than twice the poverty level which in Oklahoma is just over $20,000. But even with these guidelines, more people are eligible than you think.
And it really sounds like, Hannah, that not having insurance is more than a social problem. It's really become an economic problem as well.
That's right, Rob. And here's what's really sad. Charges for services may actually be higher for the uninsured in comparison to patients with insurance plans. And that's because insurance companies have negotiated lower fees with providers.
And it really sounds that this is a problem that is truly costing us all.
That's exactly right. According to a recent report, just covering the bills of the uninsured increases the annual health premiums for those with insurance by about $922 per year.
Well, thank you, Hannah. Nice story, and it sounds like a great program.